Hello, viewers. My name is Dr. Makarand Khochikar. I'm a urological oncologist practicing in western part of India. And guess what? Today we have none other than Professor Prokar Dasgupta, who has recently been decorated with one of the highest awards from India, that is Padma Shri. 26 January 2022. Every year, 26 January, which is a Republic Day for India, all the intellectual people, and in fact, the entire country keeps on looking for the big names who are going to receive this award. The awards are mainly Padma Awards, which are called as Padma Shri, Padma Bhushan, and Padma Vibhushan. The awards are given to people who have done exemplary work, who has been very helpful for the mankind. This year, when I looked at the list, I was pleasantly surprised and overjoyed to see my very good friend, Professor Prokar Dasgupta. I have been associated with Dr. Prokar for last 25 years, and it's in a pure heart. I just thought we should take you through the journey of my friend, Dr. Prokar Dasgupta, who has achieved so much in such a short span of time. So, welcome, Professor Prokar Dasgupta. Thank you very much for allowing me to interact with you on this wonderful occasion. Welcome, Prokar.
Makarand, thank you so much. Namaskar to all your viewers. Thank you for this marvelous opportunity. And it's only a friend like you who can do this. What a long and wonderful association. Thanks a lot.
It's my pleasure, Prokar. The reason I'm doing this interaction will show, as I said, there was a moment of joy and pride. Really, I was so overwhelmed as if I got the Padma Shri. It's said in Indian mythology as well as Indian culture, you share the joy and it multiplies. And I'm sure it holds true in all sort of part of the world. I also wanted to interview Prokar, tell them the story of Prokar, so that they get inspired in their life and career. And this is for you, Prokar. With this sort of interaction, I want more and more from you. Every surgeon doesn't want to stop his career as a surgeon. If he really wants to achieve in the life, I think he wants to become a scientist. And I'm sure our friend Prokar wanted to become a surgeon scientist from his right at the beginning, and that's what he has achieved. So in this interaction, with the association we have for the last 25 years, my friends, I'm going to take you through the journey and how he has progressed his career at such a long period of time. So let me start with Prokar now, your journey. The roots were in India. I believe it was in Lucknow, and then you got your medical school in Calcutta. Can you tell us something about it?
So I was born to my father Chira Ranjan and my mother Aruna in a beautiful steel township called Rourkela in Orissa, about 400 miles away from Kolkata. So the Lucknow story is very interesting because my mother's family is from Lucknow. So I spent very many happy days in Lucknow as a little boy, listening to Ram Leela, going on rooftops and flying kites and cutting each other's kites. In fact, we used to spend long hours trying to put a mixture of paint and little pieces of glass on the kite string so that you can cut each other's kites. This is, the whole skyline in Lucknow is full of kites flying with each other. It's a city's treasure. So Flying High Like a Kite is an editorial I wrote in the British Journal of Urology International, not because of my links to the Nawabi city, but also because in that issue of the British Journal of Urology International, which we'll talk about later, the highlight paper was from Lucknow. So I was very proud of that paper, and that brings you into context of what we did. But I went to St. Paul's School in Rourkela. I have many friends there. We have a group which is called St. Paul's Rourkela 1982. And it was the most wonderful childhood that I had in this beautiful planned city. My parents really allowed me to fly high. So I was fortunate. I received the best possible education, and they always encouraged me to do what I really felt I could achieve. So that was good. And then I went from there to Kolkata, to St. Xavier's College. I spent 2 wonderful years there. And although at this time I was debating whether the next step should be engineering or medicine, as you know, Makarand, in our days, for families like ours, you either went into medicine or you became an engineer. You know, there wasn't very much other thinking. So I got both. I got into engineering and I got into medicine. And after much thought, decided that medicine it was, because my grandfather was a medic. So, you know, that was a significant influence on me. So I ended up in Medical College, Kolkata, the oldest medical institute in the East. And I again spent a lovely time in India. I did my training there. I was the equivalent of a senior houseman there. I did my internship there. And really in those days, you learned to become a surgeon. So surgery was what really attracted me, a craft specialty. I enjoyed it more than anything else. And in fact, got one of the medals in the final exams, and it was a surgical medal. So I was pretty happy that things were going the way I wanted to. So again, Kolkata, a wonderful, bustling city, a complete change of scenario from the planned childhood in Rourkela. But then, you know, fun times. You know, we had a wonderful social life. I used to play keyboards and guitar and sing badly in a rock band. In those days, the festivals across various townships was the flavor of that time. So that band used to travel from city to city playing. So we had a fun time, and you know, I have very fond memories of my time in India.
Wonderful, because this is something I wanted to bring it to everybody's notice that even as a medical student, all the textbooks, majority of textbooks, were written by many sort of scholars from Bengal. You have sort of, Das, surgical sort of a clinical sort of a book, which is written by Das. So we were very fascinated, the academics and the history and reputation the West Bengal has in terms of academics and teaching in that part of the world. I found out with your interaction in the past, Prokar, that you initially worked on leishmaniasis and splenomegaly, one of the topical diseases in India, and tell something about it. And then how did you choose urology and how did you decide to go to UK? Briefly.
Yeah, so the work on leishmaniasis, otherwise known as Kala-Azar, a parasitic disease, a killer disease, mainly treated in those days with a drug called albendazole and mebendazole, was inspired by my surgical chief at the time, Professor Prabhat Chaudhary. And he taught me how to perform splenectomy in these massively enlarged spleens. And that was really a last resort in these patients who had drug-resistant leishmaniasis. And otherwise, you were just, you had no choice but face a death sentence. The problem was, once you took the spleen out, you had to tell the patients to take chloroquine as prophylaxis once a week. And when I tried to follow these patients up, I realized that a number of them had gone back to their villages, and about half had passed away, not from the leishmaniasis, from which we had saved them with a splenectomy, but also because they had stopped taking their chloroquine. So, that became a major issue. Now, Professor Chaudhary put the challenge to me saying, we should look into why these patients come from the brink of death to surviving as a result of the splenectomy. And his hypothesis at the time was that the CD4 CD8 lymphocyte ratio was changing. So as you took the spleen out, you took out the major reservoir of the immune response, and the ratio of the CD4 CD8 cells would flip back to normal. And that's how you got the patients by literally re-switching their immunology. So this is something we went on to test in Jadavpur, because we did not have the facilities to do this kind of testing in my own college at the time. So I went to a lab. I found out, and while my friends were having fun, I would, after long days, take the minibus from central Calcutta all the way to Jadavpur. I tracked down the lab. I learned how to stain these cells, and actually learned how to do image analysis and grid counting. So that was my first foray into science. And at the same time, I was not just reading the textbooks, like you mentioned, Bailey and Love, for example, this surgical book that we all read, but also reading a number of journals and having a critical appraisal of what it meant to look at science and not just be bookish. So the curiosity was always there. And at the time, I was actively trying to go to Harvard, to the School of Immunology, and that is what I really wanted to do, although Professor Chowdhury said that apparently I had the hands of a surgeon. So in those days, you didn't disobey your dad, and you certainly didn't disobey your chief. So that's what I became, a surgeon. Urology was really an accident. It was inspired by Dr. Sivaji Basu, still active in Eastern India, and a famous stone surgeon. And Shivaji Da had returned from the UK and brought in the first lithotripter in Eastern India into Kolkata. And at this time, people, even for the tiniest little stone, were having open surgery. There was no PCNL, and the concept of ureteroscopy had certainly not come. And I was happily doing open stone surgery, just like I'm sure you did. And suddenly there comes Shivaji Da with a denier and completely changes the game. And I can tell you there were patients, my own family members, who went on to have treatment on the lithotripter. And I thought, look, this is a complete shift. You go from open surgery with its morbidity to no surgery. I mean, just unbelievable. And that's what inspired me to come into urology. Destination UK, well, I met Chris Booth, who I'm still in very close touch with. We worked together on a charity on prostate cancer called CHAPS in the UK, CHAPS. And Chris Booth invited me to join Colchester General Hospital, a beautiful part of Eastern Britain, an old Roman city. And this goes back to 1992. And I remember writing a paper with him in the short time I was there, published it in the Scandinavian Journal of Urology. Chris was clearly impressed. I then actually returned to India because I was hoping to continue working with Professor Chowdhury. And then one thing led to the other, and I ended up back in UK and have had such a fun time working here and, dare I say, in India. So I've been a global citizen, and it's all come full circle, so to say.
Wonderful. So I think basically all the people around whom you work with, I think the inspiration what you had, and I think the scientific mind, I think the seeds were sown in Calcutta itself, and I could sort of vividly see all those sort of virtues in me in last 25 years.